Classification. Block 10 Pathology. Topic: Oral cavity and salivary gland tumors. Oral infectious diseases. First we will study about the classification of oral infectious diseases. So there are basically three types of oral infectious diseases that are viral, bacterial, and fungal. Viral ones include Heroes simplex virus, human papilloma virus, and Epstein-Barr virus. In fungal infections we have candidiasis, and in bacterial there are acute necrotizing gingivitis and syphilis. Herpes simplex infection is usually caused by HSV type 1. Morphologically, it presents as painful vesicles that rupture to form shallow ulcers with an erythematous base. These lesions commonly occur on the lips and oral mucosa and may recur repeatedly, producing cold sores. Microscopically, multinucleated giant cells and intranuclear inclusions are characteristic findings. Human papillomavirus causes papillary lesions in the oral cavity. HPV types 6 and 11 are associated with benign papillomas, while HPV 16 is associated with oral squamous cell carcinoma. Morphologically, these lesions show exophytic papillary growth with finger-like projections and a warty appearance. Microscopically, coilocytosis and hyperkeratosis are seen. Epstein-Barr virus is associated with oral hairy leukoplakia, especially in immunosuppressed individuals and HIV patients. Morphologically, it presents as white corrugated plaques on the lateral border of the tongue. Unlike candidiasis, these plaques cannot be scraped off. Microscopy shows hyperparakeratosis, epithelial hyperplasia, and balloon cells. Oral candidiasis is the most common fungal infection of the oral cavity and is caused by Candida albicans. It commonly occurs in immunosuppressed patients, diabetics, denture users, or after prolonged antibiotic use. Morphologically, it appears as white curd-like plaques that can be scraped off easily, leaving an erythematous surface underneath. Microscopy shows fungal hyphae invading the superficial epithelium. Acute necrotizing gingivitis, also called trench mouth, is caused by mixed anaerobic bacteria. Morphologically, patients develop painful ulcerative gingiva with gray pseudomembrane formation, foul odor, and bleeding gums. Microscopy shows necrosis and acute inflammatory infiltrate. Oral syphilis is caused by Treponema pallidum. In the primary stage, a chancre may develop. Secondary syphilis causes mucus patches, while tertiary syphilis may produce gumma formation. Microscopically, chronic inflammatory infiltrate rich in plasma cells is characteristic. Now let's quickly revise the important oral infectious diseases in a single chart. Starting with herpes simplex virus, it is usually caused by HSV type 1 and presents with painful vesicles that rupture to form shallow ulcers. Microscopically, multinucleated giant cells are seen, and recurrent cold sores are a common feature. Next is oral candidiasis caused by Candida albicans. It appears as white curd-like plaques that can be scraped off easily, leaving an erythematous surface underneath. Histology shows fungal hyphae invading the superficial epithelium. It is the most common fungal infection of the oral cavity. HPV-associated lesions show papillary or warty growths. HPV 6 and 11 are associated with benign papillomas, while HPV 16 is linked with oral squamous cell carcinoma. Coilocytosis is the characteristic microscopic feature. Epstein-Barr virus causes oral hairy leukoplakia, especially in immunosuppressed patients. These are white corrugated plaques on the lateral border of the tongue that cannot be scraped off. Acute necrotizing gingivitis, also known as trench mouth, is caused by anaerobic bacteria. Patients develop painful necrotic gums with foul odor and bleeding. Histology shows necrosis and acute inflammatory infiltrate. Lastly, syphilis caused by Treponema pallidum may produce chancre, mucus patches, and gumma formation in different stages of disease. Plasma cell infiltrate is a characteristic microscopic finding. Thank you.